Okay. The Medicare Savings Plan is a state program, and it's a wonderful program if you qualify for the QMB program.
Which is the Silver Connect card that the caller was referring to.
Right.
All right, go ahead.
As a single, if your income is $1,778.91, which includes the Part B premium, you will qualify for the QMB program. In that case, you will get your $96.40 back. You will get a Silver Connect card from the state, which allows your co-pays to be paid for, and you will pay a zero premium for most of your drugs and not pay any more than $2.60 and $6.50 in 2012.
Nice new updates on that.
Yeah.
Yeah, she got that right.
So, and then if your income's a little bit higher and you run into, say, up to $2,091.61.
Hold on, Miss Popularity. They're waiting for you. Caller on line 1 for Medicare and You. How can we help you?
Hi, Mr. Regan?
Yes.
My name is Rich. I'm calling from Middlebury.
Okay, no last names for HIPAA, Rich, please.
Pardon me?
No last names for HIPAA reasons.
No last name.
Okay.
I worked with your mom and a friend of hers, Roger McAllister, on a United Way campaign back in the 60s.
All right.
I'm retired from the insurance business. Your mom was an absolute sweetheart and would be very proud of what you're doing.
You are a good caller. Thank you very much.
You're welcome. Have a good day.
Yourself the same, Rich. Appreciate you listening.
Bye.
Oh, that's wonderful.
Right. You take over. I don't want my head to get big. Producer Nick, if it gets big, you pop it. Okay. All right. None of that. Appreciate you listening out there. All right. Go ahead.
Okay. Is it me or is it
you?
the caller?
No. Producer Tom will do the caller sign.
Just to let you know, if your income's a little bit higher for the Medicare Savings Plan, such as $2,091.61, if you are a single person, and again, you need to include the Part B premium, or $2,816.67 for a couple, you will qualify for the ALMB or SLMB program, which still gives you back the $96.40 for your Part B, and it also allows you to pay only $260 or $650 for your prescriptions, and hopefully we can find you a zero premium plan. So, I mean, it's a great, great program, and I thought everybody in the world knew about it, but I'm still getting phone calls, and people still aren't on it. The other thing is it gives you a special enrollment period that you don't need to wait for open enrollment to change your plans. You can change every month if you so choose. I don't think you would want to, but
no,
you certainly can.
But if you qualify for the Silver Connect card or one of these Medicare savings programs, you will be allowed 63 days, which is an SEP, to find alternative insurance. So, okay, what do you find the rush is going? They're coming in looking for the Medicare savings program. They're looking for advice on their prescriptions. What are you guys fielding a lot of calls these days with?
Pretty much the prescription D obviously is a big change. Advantage plans, they're looking at those.
Absolutely.
People are looking at ways to save money.
In this economy, you have to.
It is. And you have to realize, we know that you are all on a fixed income. And for many of you, to pay $200 a month is a hardship. It's more than just you need to have the coverage. It's a hardship.
I spoke to pretty much every person I could, and I'm trying to get back to them. And when they say, I don't travel out of Connecticut, I never go anywhere, I've only used this one doctor and this hospital, you only buy a Medicare supplement, A, because you have money, and you aren't too concerned about the week-by-week or month-by-month budget. You have money, you're affluent, you're doing well for yourself, you want the freedom. A Medicare supplement means you can use any doctor or any hospital that accepts Medicare assignment. That's beautiful. But for someone that stays local, that keeps their doctor, that keeps the same hospital, you should be looking at some of the Advantage plans. And please, let me stress, and go to Daryl before you go to me, because I am an insurance agent. I sell items. Daryl works for a nonprofit. They're 100% the Agency on Aging. Western Connecticut Area Agency on Aging is there just to help you. I'm going to have you go over the grant for the silver sneakers in a little while, but more importantly, I want to touch on this because My phone is ringing off the hook. You need to check the formulary. There's a Blue Cross Blue Shield plan out there. It's called a PPO, an LPPO to be exact. It does not have Waterbury or St. Mary's Hospital in the network yet. You need to check the formulary on that plan. It sounds great. You get tons of information in your mailbox, 0 premium, 0 to your doctor, 0 drugs. But if you're a Medicare eligible beneficiary and you take prescriptions, you need to check the formulary. Yes. And also, you need to ask questions like, Daryl, what is a benchmark plan?
There are 10 benchmark plans this year.
And let's go over those because that's important. Seniors, are you listening out there?
I've got them here, and I'm going to tell you what they are.
Thank you.
Aetna, CVS Pharmacy, PDP. Cigna, Medicare RX Plan 1. Community CCRX Basic. First Health Premier. HealthNet Orange, Option 1.
No longer available in the state of Connecticut.
Right. HealthSpring Region 2. Humana Walmart Preferred. CVS Caremark Value. United American. And finally, WellCare Classic. If you're not sure whether you have a benchmark plan, you can call us. We can match the numbers to make sure that that's what you're signing up for. The other thing I want to mention, please, 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 we have so many people that call up. I don't take any prescriptions, so I haven't had a plan in 5 years. Well, you're going to pay for that. You have to have a prescription D plan. It's mandated. It's not an option. The cheapest one right now is Humana, Walmart. It's $15.10 a month. You have to have a plan. If you don't take any drugs, buy it.
And let me go over this slowly. If you are a hippie out there and you hate insurance agents, you barely like me, you've always said, I'm not buying it. Congresswoman Nancy Johnson and her constituents at Health and Human Resources and CMS and Pfizer and insurance companies, everyone got on board. It was a federal guideline enacted June 1st, 2006. If you did not purchase a Part D from June 1st, 2006, you are going to be penalized 1% per month of the national average. If you're still out there holding off and saying, I don't take prescriptions, you will be meeting my fantastic friends, and hopefully no last names. Kathy and I spoke this morning, and she wasn't allowed to call in to the show, but I will get approval from CMS because people need to know this.
Right. They definitely do.
You have a late penalty. I myself am going to even fold this so in case you're watching on YouTube, you can't see it. Dear Mr. A, this letter is to inform you of our decision on your Medicare Part D late enrollment penalty appeal. This appeal is a new and independent review. You are receiving this letter because you requested an appeal for your name. Our decision, the appeal decision is favorable. Our decision is that you are not subject to a late enrollment penalty. I had to, for 2 months, write letters for my clients, show them that they had credible coverage. These people were paying $28. They're up in their 80s. No, that's as much as I can tell you. But anyway, if you're listening out there and you are getting a penalty, you can call Maximus Federal Services. It is an entity of CMS. Their phone number is 1-877-456-5302. Daryl, were you aware of this?
Yes.
Oh, of course.
Yes.
She knows everything. The independent review entity, it's Maximus. It's up near Buffalo, New York. Mm-hmm. And this is where everything in the country goes for the late penalty. Why am I getting excited about this stuff? Because I love a client to get this waived.
Right.
I don't want a client to pay that. First of all, I didn't do my job. Second of all, it's not just about the commission. This is how you gain momentum and you get referrals, and they're literally waiting for Gene and I at the door to open up at 9 o'clock. So from the bottom of my heart to all the clients out there that buy from me, thank you. And Gene and I both thank you. Stephanie, Angela, you're doing a great job knocking out all the applications. So you're going to get a late penalty on that. Another thing that's important to realize is if December 7th goes by and you didn't do anything, we can't help you. All right? Plug your agency a little bit more. Producer Tom, what about do we have a second commercial break?
Yes, we do, yeah.
Ah, shoot. All right, we're going to have to take a break to plug the sponsors, but we'll be back as soon as we can. He gives you the... And we're back. All right, I am going to do something rare, and that's just be quiet and shut up. Daryl, take over.
I just want to give you a little bit of a reminder that the Part B premiums are changing this year. For those of you that have been paying $96, unfortunately, yours will go up a few dollars. It'll go to $99.90. But for those of you that are paying $115, yours is also going to go down to $99.90. But you did get a 3% increase from Social Security, so hopefully it'll pretty much balance out and you'll all make out better than worse. I just wanted to let you know that the highest prescription drug plan is also with Humana, and that's $110.20, and we really ask you to evaluate plans again so that you are getting the most economical plan to meet your needs. And I can't stress this enough. If your neighbor says, I have a great plan, that doesn't necessarily mean that's a great plan for you. You need to look at your needs. I know it's so easy to just want either Michael or myself to do all the work and just tell you, oh, you should do this. But we can't. We simply can't. So we need to know what your needs are, your precise needs are, and we can give you our best guess. The other thing we cannot do is I've had people say, so what if my doctor adds all these different drugs? I don't have a crystal ball in front of me. If I didn't put it into the system, I can't take it out of the system. We hope for the best. We all try to give you the best plans possible to keep you on track.
For this window of time.
Right.
People's needs change. People go through events. They, life is changing, by the way. Lipitor, November 30th, December 1st, it's generic. Don't know if it's going to go away, but they're allowing the more generic. So if those of you out there, I'm sure you're already aware. If not, it's going to go generic. All right. We've had a good show. I am honored to have Daryl Willenbrock with the Western Connecticut Area Agency on Aging.
And Mike and I are going to say one more thing. December 7th.
Let Daryl take this one, please.
We're going home at 4 o'clock. Mike's going home at 8 o'clock. We're not working all night. December 7th, last day to change.
That was October 15th through December 7th, which was annual election period. Daryl calls it open enrollment. We as agents have to call it annual election period, AEP. We have been working around the clock. I'm sure my entire staff is not even going to come in on the 8th. I don't even know what day the 8th is. But please, don't procrastinate. Be proactive. If you can't get me, you can see Gene. Gene's just as intelligent as I am. All right. I sincerely appreciate everyone calling in. I love doing the show. Daryl, thank you so much for being a guest.
No problem.
You rocked it today. All right. We are going to head to the airwaves, and hopefully syndication is coming. We have 15 seconds left, so let me thank my fantastic staff, my family, for letting Dad work all these hours. All right. Enjoy your day. Thursday, 2 o'clock. We're out.